nous nous engageons à vous offrir le meilleur. Pour vous, nous ne cesserons jamais d'innover pour toujours mieux vous servir.
You made the right choice by choosing G24 to inform you. Ladies and gentlemen, good evening and welcome to this news tour of 13 minutes. For now, let's have a quick look at the summary. Like every 1st December, today is World HIV International Day. The newsroom of G24 proposes a focus on this disease written by our genius Jean-Cyril Ondomengue. Also, the World Health Organization WHO on Tuesday advised groups, including those who feel sick and seniors aged 60 and above, to delay their travel plans. Ladies and gentlemen, stay tuned. I'll be back in a fist of seconds. Once more, welcome back. In opening of this news edition, the focus announced in the headlines: for fear of being excluded by their communities, men and women sometimes refuse to be tested to determine their status, and those who are HIV positive hide their condition. Jean-Cyril Ondomengue of the English newsroom of G24 made this focus for you. Let's listen.
For fears of being excluded by their communities, men and women sometimes refuse to be tested to determine their status, and those who are HIV positive hide their condition. People living with HIV or AIDS feel ashamed and as a result isolate themselves. Often families blame, neglect, or drive away the sick person to avoid negative reactions from their neighbors. Communities, which are another source of support, reject them, seeing their infection as the result of dangerous, reckless, and decadent actions. In the wider society, schools, workplaces, churches, hospitals, clinics, and similar institutions sometimes contribute to an atmosphere that encourages discrimination and stigma. Infected persons are denied employment, education, treatment and care, and the right to confidentiality in the hospital setting. After reading the above, one has to wonder how this pandemic can be stopped. These words are from Dr. Michel Sidibe, Executive Director of the UN AIDS, reminding us of the prerequisites. Why people living with HIV or at risk of being infected are discriminated in healthcare settings, they hide. This seriously hampers our ability to provide HIV-positive people with testing, treatment, and prevention services. How do we end HIV? How do we end inequality? How do we end pandemics? How to deal with rejection, stigmatization, humiliation, and sometimes even abandonment when one is alone in the face of fatality. The late Dr. Edith Lucy Bongo, speaking on behalf of OPDAS, the Organization of African First Ladies Against HIV/AIDS, reminded us several years ago, and I quote, "Fighting AIDS is not only prevention, it is also and above all telling people living with HIV/AIDS that they are not alone." End of quote. Do we need to leave the University of Health Sciences of Gabon to understand that no progress is possible when obstacles become norms? Why reject those who have the most of all? Advances in HIV medical care over the past 35 years have allowed people living with HIV to have a life expectancy similar to that of everyone else. Why reject them? It is scientifically proven that with effective treatment, people living with HIV/AIDS can no longer transmit the virus. Unfortunately, the stigma associated with HIV remains considerable, including in care settings. Stigma is not a vague sociological notion, but a real public health issue that can have an impact on both HIV-negative people and people living with HIV/AIDS. It has a negative impact on infection prevention, testing, access to care, and health management for people living with AIDS. Addressing stigma is essential to ensuring optimal medical and psychosocial care for people living with AIDS and to fighting the HIV/AIDS epidemic. How do we end HIV? How do we end inequality? How do we end pandemics? Perhaps start by accepting the other with his or her difference, accepting that it doesn't just happen to others and that no one is immune to an illness. To say no to stigmatization is to tell them that they are not alone and that love and medical care will allow them to transcend.
We stay in World AIDS Day, and to commemorate this day, Gabon opted for free awareness and testing on this December 1st. The Gabonese Minister of Health, Guy Patrick Obiondong, the Director General of AIDS Prevention, the UN AIDS Country Director, and the Director of the National Program for the Fight Against this and HIV/AIDS all participated in their own way to make young students aware of this disease. Akenenge Yan tells us more about this story.
Among the sites selected for the HIV/AIDS testing and awareness campaign in the commune of Libreville, there is the Jean-Hilaire Obam-Eyege High School located in the 6th district of the capital city. As soon as he arrived on the site, the Gabonese Minister of Health, Guy Patrick Obiondong, tackled the main issue, raising awareness among students. Awareness and raising campaigns that are very appropriate in the view of the figures that show that young people are increasingly affected by HIV.
We chose Zion to focus on youth who are increasingly exposed to HIV/AIDS. They are vulnerable and their future can be compromised if they are infected. This is why it is important to focus on contraceptive awareness.
For young people at the center of this anonymous sensitization and screening, awareness of the virus remains the key word. Despite COVID-19, Gabon is managing to distinguish itself in the fight against AIDS. This is thanks to the multi-sectoral fight. In Gabon, the lines are moving in the fight against HIV and AIDS, even if several points still need to be improved.
We've already put in place a certain number of instruments in terms of awareness, care and screening, without forgetting that COVID-19 has had an impact on other diseases, a reason why, in partnership with the Ministry of Education, we're going to reactivate health clubs in high schools.
The awareness campaign, free and anonymous and HIV testing open on this day, will extend to several other establishments in the capital city, Libreville, and the interior part of the country.
Also, we announced this information in our previous edition of news. The Gabonese capital, Libreville, has been hosting since Wednesday until December 3rd the 35th Congress of the International Conference of Bars. For more details, we'll listen to Futibi Muleka.
The event brings together several jurisdictions, local and international organizations to discuss, among other things, the issue of the rule of law in member countries. Focused on the theme, Law and Justice to the Test of COVID-19, this three-day meeting in Libreville is focused on issues related to civil liberties, democracy, and the rule of the law. The International Bar Association Conference aims at creating a structure of cooperation between the bars of countries with a common legal tradition, that is to say, essentially the French-speaking bars. It groups bars around an ideal of independence and whose governing bodies are democratically appointed by the lawyers themselves. While respecting the autonomy of bars, its mission is to assist them in their efforts to uphold the rule of law and to implement the concept of the universal nature of human rights, in particular the right of the defense. As a reminder, the International Bar Association Conference was created in November 1985 and brings together 87 French-speaking bars and bar associations in the pursuit of its mission of cooperation between bars, in particular the defense of the independence of bar associations. It develops exchange of information and experiences between bars and support the organization of common training sessions. It also carries out observation mission for the protection of the right of the defense and the respect of human rights.
From justice to health, as announced in the headline, the World Health Organization on Tuesday advised groups, including those who feel sick and seniors aged 60 and above, to delay their travel plans as cases of highly transmissible Omicron variant has been detected in multiple parts of the world. We listen to Yana Kenenge, who has the details about this.
The World Health Organization advised to postpone travel to areas with community transmission for people who are unwell, not being fully vaccinated, and are in increased risk of developing severe disease or even dying. And this includes people over 60 years old and those with comorbidities that present increased risk of severe COVID-19. Meanwhile, the WHO urged countries to keep calm and take rational measures in response to the new COVID-19 variant Omicron. The call is for all member states to take rational, proportional risk reduction measures through the Director General Tedros Adhanom Ghebreyesus, as it was warned that blanket travel bans will not prevent the international spread of the Omicron variant, even as dozens of countries have already introduced such restrictions. Although Omicron has been labeled as a variant of concern by the World Health Organization, it is said that this blanket travel bans will only place a heavy burden on lives and livelihoods, while also desensitizing countries to report and share epidemiological and sequencing data. The Omicron variant was first reported by the WHO by South Africa last week, and so far cases have been reported throughout the world. Dozens of countries have already tightened their travel measures and even suspended flights. The World Health Organization thanked Botswana and South Africa for detecting and reporting this variant with spread and transparency, which allowed other countries to rapidly adjust their response measures in the context of the pandemic, noting that the institution called on countries to show global solidarity in rapid and transparent information sharing in the joint response to COVID-19 variants, including Omicron.
This information marks the end of this newscast, but with the permission of our news director, Alex Ngoy, let's review the main headlines. Like every 1st December, today is World HIV International Day. The newsroom of G24 proposed a focus on this disease, which was written by our genius John Cyril Ondomungu. Also, the World Health Organization on Tuesday advised groups, including those who feel sick and seniors aged 60 and above, to delay their travel plans around the world. We thank you for staying faithful to our newscast. Information continues on G24 and our social medias. Subscribe, share, and stay tuned for more programs on G24. Next edition of Information in English, 10:30 p.m. local time, and Gauma PC at 8 p.m. local time in Central Africa will serve you information in French. Till we meet again, take care of yourselves and goodbye.